Perfect. Dr. Davidson,
Perfect.
thanks a lot for joining us from New Zealand. Can you give us a little sense of your background, Ross?
Yeah, Lee, I'm an orthopedic surgeon by training and used to work at the Allan McGavin Sports Medicine Clinic at the University of British Columbia, and was involved there and was past head physician of the Vancouver Canucks Hockey Club. After I had left Canada and returned to New Zealand in 2000, I worked at Unisport Sports Medicine Centre in Auckland, and for the last 5 years had run the postgraduate program in sports medicine at the University of Auckland. So my career effectively has been the whole time devoted to sports medicine, and in particular orthopedic sports medicine.
That's exciting. And how did you hear about Replacel, and what's your involvement with Replacel at this point?
I actually heard by word of mouth about Replacel and its initial product development, and then as the research went on into the hair study and they developed the cellular regeneration techniques and noted that the non-bulbar dermal sheath cells were in fact great producers of collagen. And it was at that point that they started to become interested in perhaps how this could be used in therapeutic ways to try and treat chronic conditions, particularly like tendinosis, where the cellular component has almost failed and there's been a lack of response, or the healing process has burned out, if you like.
What is tendinosis, Ross?
Tendinosis is a condition in tendons, as the name implies, that is an end stage of tendinitis. Tendinitis is where the tendon becomes inflamed, painful, swollen, and sore, and is treated by the usual modalities of anti-inflammatories, contrast therapy such as ice and ultrasound, manipulation, stretching, strengthening, and that sort of activity to promote healing. If the healing response doesn't progress, then what happens is the disease progresses to tendinosis, which is really damage to the tendon at the cellular level, where you see a lack of inflammatory cells present in the tissue damage, and you see degeneration within the tendon itself. So if you go in and look at the tendon itself, you find that there really are no traditional inflammatory cells present in it. It's the healing response has burned out.
How does someone know if they have tendinosis?
They will have suffered from tendinitis, which will have given them the symptoms of pain, swelling, and local inflammation as such. But what happens with tendinosis is that the symptoms persist in spite of treatment, and the actual diagnosis of tendinosis requires almost some imaging of the site. This is where ultrasound has come into its own, in that we can image tendons, and it will show the altered ultrastructure of the tendon itself and the lack of response, and almost the degeneration within the tendon that takes place with tendinosis. So it's a clinical diagnosis initially, but confirmed or supported by the use of ultrasound imaging.
And as an orthopedic surgeon who spent their entire career focusing on sports-related injuries like this and working largely with a lot of athletes, what can you do? What are the current treatments available for this kind of chronic tendinosis now?
Well, there's been a multitude of treatments that have been tried over the years, from eccentric exercises to injection of hypertonic glucose solution, so-called sclerotherapy, to injection of PRP or platelet-enriched plasma to try and promote a healing response, electroshockwave therapy has been used, all sorts of things to try and initiate and stimulate a healing response within the tendon. And because of the multitude of treatments that are there, it tells you that there has been no real treatment that has solved the problem at all. At one point, we used to operate on these, and in fact still do. But to undertake surgery on a tendon, that's a big undertaking with all the risks that go with surgery as well. And it's a very long recovery period after that.
And what are the measures? How do you measure whether or not someone's getting better with this chronic kind of condition?
The two measures effectively are, one, how they feel, what they're able to do. In other words, improvement in their symptoms. And so if they're getting better, you'll notice a lessening of the pain, an improvement in the function that they're able to offer or to carry out. And you'll notice that over time there may be some decrease in the swelling as well. But that doesn't necessarily follow. But that's what you're looking at in it. And if you follow it on ultrasound injection, you would ultrasound studies, you would hope to see some improvement in the ultrastructure of the tendon itself as the healing progresses.
Are there standard ways of measuring pain and function as a clinician?
Yes, there are. Well, there have been attempts to try and standardize measurement of pain and function, and the two big tests that are used, particularly around tendinosis and particularly Achilles tendinosis, is the so-called VISA-A score. VISA standing for Victoria Institute of Sport assessment. The second A stands for Achilles, and it's a series of 6 different things, or 10 different things actually, that you do or assess around the tendon to get an overall score. It's measured on pain, function, swelling, how long it's stiff and sore for, and effectively what you can do for it. It's a functional test that gives a measure of how the patient clinically is improving. And then the other one that people use is just the VAS scale, which is a visual analog scale, and that's where you just basically assess your pain over the period of time and tenderness to palpation of the tendon and whether that's improving or not improving. So they're reasonably reproducible studies, but not hugely accurate.
You mentioned before that when you started following Replacel, you became particularly interested in the cell population that Replacel was developing that was highly expressive of collagen, and that spurred your imagination to think about how you might be able to use that in tendinosis. What's the connection between collagen and tendons, Dr. Davidson?
Well, collagen it forms the fiber that's within the tendon. Collagen is what gives the tendon its strength and allows it to function the way it does. There are three types of collagen that are common in tendons: type 1, type 2, and type 3. Type 1 is the most effective, biggest band and the strongest that's present in tendon, type 3 being the smallest and not as well organized. It's interesting that the cell population that Replacel was investigating produces very good amounts of type 1 collagen, which is effectively the good collagen that you want in tendon repair and regeneration.
So as an orthopedic surgeon who's seen a lot of these kinds of patients and someone who's been following and even giving Replacel some advice on clinical trial design and things, what's your take, what's your thoughts on the small clinical data trial data that Replacel just announced as a physician?
Well, I'm very excited about it because I think this is a chance to use a therapeutic regime that has the potential to actually promote healing of chronic tendinosis in certain areas. The first thing I'm really excited about is the safety profile. The good thing about this is that the cells that are injected in the study are the patient's own cells. In other words, they take a biopsy, the cells are cultured and then re-injected back. So that's a great thing to happen. That's the person's own cells that they're getting back when they do something. The second thing that I'm really encouraged about is the fact that from the early preliminary studies, there has been no major adverse effects at all from doing this. And the third thing is when you look at the results that have come out, and admittedly it's only a very small study, but it has done extremely well with regards to the visual analog scores of the patients that were injected. Nearly 70% of them have shown significant improvement in this very small study, and I think that this behoves well that this, in fact, with further study, understanding dosages and everything else, has a real chance to become what I would call it almost a game changer.
That's exciting. Do you think, I'm going to ask you to prognosticate a little bit, but do you think if Replacel can show the kind of this kind of regeneration and some restoration of function and reduction of pain in tendinosis of the Achilles tendon, is that something that can be fairly extrapolated across tennis elbow, golfer's elbow, jumper's knee, etc.?
I think that, yeah, because the tendon that's involved in all these sites is similar tendon. So if this is shown in Achilles tendon, then I certainly see that. Golfer's elbow, patella tendonitis or tendinosis, and jumper's knee, particularly. The one problem with shoulders that needs to be solved, I guess, is how you can contain the cells once they're injected. It's a little easier to do it in an Achilles tendon or a patella tendon than it is in a shoulder where there's a big subacromial bursa that's present as well. But that will certainly, hopefully be able to be treated in the future when we look at how we're able to contain the cells in that area. So I think that
Sure.
this offers huge chances for any chronic tendinopathy.
And I guess another extrapolation, if the product is demonstrated to be effective in regenerating tendons for those people who have a chronic condition like you've described, tendinosis, is it something that physicians would be interested in taking further up the the injury event scale to try and investigate whether or not it might be something more useful in an acute setting?
I certainly think that would be so, particularly in ligamentous injuries and in other sort of tendon injuries. It may well be that, and this has to be investigated, but the initial injury occurs, the initial healing responses are now allowed to initiate, and somewhere between 5 to 10 days post-injury, the patient actually gets an injection of cells into the area to further bolster the healing response so that this, in fact, will be speeded up. And I think that offers the possibilities of markedly decreasing healing time and improving the strength of the repair or healed tendon. And when you start to look at time, professional sports springs to mind, where you want to try and reduce the downtime of all these athletes that are injured there. So yes, that it's significant.
Well, that dovetails in, I guess, 2 more questions. But you were, as you said, a medical doctor for the Vancouver Canucks hockey team for many years, and president, I believe, of the Physicians Association for the Hockey League as well. Is this something that as someone who's dedicated a lot of his career to working with professional athletes, something that you think would be used in that kind of setting in addition to just treating the regular golfer, tennis player, runner in life?
I certainly think that there could be big uses for this technology in the treatment of acute injuries, and particularly in professional sports people. It needs to have more study and more investigation done at this point to ascertain, what happens when you put these cells into an acute injury setting as opposed to a chronic injury setting, and you'd certainly have to look at dosages and things like that would be involved. But I think the possibilities are significant.
Well, it's exciting to hear you to hear you say so. One last question, I guess, Dr. Davidson. An increasing percentage of the population interested in these kinds of regenerative medicines and cell therapies are, people that we might describe as baby boomers who want to stay much more active in their senior years than previous generations might have been inclined to do. Do you think this is something that would work in people 50 plus just as well as people who are younger? Would you anticipate? Obviously, that's not something I don't think that there's any data around. But as a physician, just was curious on your thoughts.
I would certainly expect that to be so. One of the problems we get as we age as an athlete is our healing responses are not quite as powerful as they were initially, and we all seem to notice that it takes us longer to get over things. And I think that the way in which this cellular regenerative technique works is that it tends to kickstart or boost the healing response. And so I see that this could well work into the baby boomer population, as you call it, and is not just a type of therapy that's to target young, fit, active athletes as such in the prime of their careers, but people who are getting further on in their careers who have tendon problems. Oftentimes the healing responses are slow and somewhat muted, and I see that this could well benefit those people in allowing their healing responses to be kick-started. Yes.
Ross, I really appreciate you taking the time to answer our questions and give listeners a little bit more color on what you see in this condition, what you see as the potential for regenerative medicine, cell therapies, and particularly the product Replacell is looking to develop. From your perspective as a physician and as someone who's been watching Replacell for some time, any last comments?
I'm just extremely excited about what this has shown us to this point. And as I said at the start, the two big things are, one, the safety profile, which has been very important to demonstrate how good it's been. And the second is that in this study, the progress and that's shown in the results. And so I think, yes, I'm very excited about what this has to offer. And then cellular regenerative therapy as a whole, I think it's a whole new area that we're entering into.
Thanks again, Ross. Really appreciate it.
You're very welcome.